This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right. Well, good morning, everybody. So this is a quick medical minute on kind of a little article from the New England Journal a few months ago. So, we talk a lot about, currently we're talking a lot about racial bias in society. In medicine in particular, there's a lot of kind of racial bias based on, sometimes provider, sometimes system issues. But there was an interesting study called Racial Bias in Pulse Oximetry, which is kind of an interesting thing to think about. And, this study looked at the idea of occult hypoxemia, which is the idea that sometimes even when the pulse ox reads greater than 92%, the actual oxygen saturation based on a blood gas is actually lower than 88%. And this study compared, a couple of large cohorts, kind of groups of 10,000 patients that were, had these data available, and compared patients who identified as Black compared to patients otherwise, white patients. And they found that the rate of occult hypoxemia was 3 times higher in patients that identified as Black. And the rates were about 12% compared to 4%. And, it somewhat makes sense. A pulse ox is based on reading different light waves through your finger, through your skin. And, the studies or the devices were originally studied, mostly in white patients, and, they were set up to work. So, what do we do about this? The idea is, potentially if we have somebody who is not white, has darker skin, and their SATs are reading, maybe borderline like 91, 92%, but they don't look that great, we should question, is the pulse ox actually accurate? It's, pretty relevant in the day of COVID, where we're making a lot of decisions on, who needs to be admitted, who needs home oxygen, who needs, pretty advanced treatments based on a pure pulse ox reading without, paying attention to a lot of things like how they look. Some people suggest getting an ABG if we're curious. ABGs are not fun, invasive, but if there is somebody who really, doesn't look great, looks worse than their SATs look, and, they're kind of borderline and they kind of meet a characteristic, darker skin, potentially an ABG could really change their treatment and, be pretty relevant. So, any questions? All right, thank you.
Hello, EMM listeners. We are dedicated to providing you with high-quality educational content free of charge and without ads. As a nonprofit organization, we rely solely on donations. So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.